The federal government of Nigeria, through the National Malaria Elimination Program, has embarked on a comprehensive malaria elimination initiative utilizing data modeling techniques to combat disease transmission and prevention across the country. This program aims to significantly reduce the malaria burden in Nigeria, which currently accounts for a staggering 27% of global malaria cases and 32% of global malaria-related deaths. The National Coordinator, National Malaria Elimination Program, at the unveiling of the flagship Malaria Modeling Fellows in Abuja, emphasized the need to build a network of proficient modelers throughout the nation to support the ambitious goal of malaria elimination. Consilia Ewozie has more on this report.
According to reports, an estimated 247 million cases of malaria worldwide, 4 African countries accounted for just over half of all malaria deaths worldwide. This high disease burden has necessitated the plan to embark on a malaria elimination initiative utilizing data modeling techniques to combat disease transmission and prevention across the country. Speaking at the unveiling in Abuja, the National Coordinator National Malaria Elimination Program, Perpetua Ohomobi, who emphasized that data-driven strategies and predictive modeling would play a vital role in reducing disease burden in Nigeria.
Part of this exercise is to build modelers in country, technical people across different programs and in the ministry, in the sub-national level that are already implementing malaria program. How we can build them with skills that will better help them to do efficient program implementation, because you know that even with all these contexts, we need funding. But then again, how do you then manage the thin resources that you have to ensure better program implementation? So we will use different contexts, different states, so that this cohort of modelers that we will build from this fellowship program will be able to go back to their different programs and their states to contextualize that within their own setting and see how they can better improve malaria, so that we meet our targets of ensuring zero malaria in Nigeria.
The representative from the Nigerian Center for Disease Control, NCDC, Chinwe Ochu, who emphasized the target of bringing the disease burden down to a pre-elimination phase, said that the ambition goal requires innovative approaches that combine the power of data analysis and evidence-based interventions.
Our target is to bring down, that's the target of the Nigeria Malaria Elimination Program, is to bring down the prevalence of malaria from what it is now to what we call the pre-elimination phase. We are still high burden currently, but efforts have been put in place, collective efforts using different strategies to ensure that we'll come down from where we are currently. As we heard from the National Coordinator at this meeting, that Nigeria has a goal now that is set for 2025 to bring down the prevalence from what it is now to a stage where we'll be more comfortable to say, yes, we have made significant progress. All these efforts put together, including being able to model and predict outbreaks and predict what will be the response to any form of intervention that is brought into the country, is what will help us to achieve these pre-elimination targets that we have as a country.
Also speaking, a member of Program Management Team for the Malaria Modeling Fellowship provided an overview of the malaria modeling initiatives.
We want to use the data we have already in Nigeria. Previously, what we have is having the knowledge from outside Nigeria. And so they use the knowledge they have to teach us to interpret on what to do in Nigeria. But now we are bringing that knowledge here to use the data sets we have in Nigeria from all of the interventions that we are doing and seeing to use it to put into the model so that we have something that works for Nigeria, not for any other country. That's why we want to build that skill among health practitioners, among statisticians, and among program managers and people who are directly involved in health interventions in malaria, in other health preventive infectious diseases.
Some of the malaria modeling fellows shared their knowledge and outlined the targets they aim to achieve.
Data, we intend to ensure we get good quality data, and we make that data, we convert the data to information that the government will use to make informed decisions to be able to change policy. So that's what we hope that the modeling is going to help us achieve. The application, we can use it to predict and then to plan for future.
The primary aim of the program is to leverage data analysis to predict and plan for preventive measures by utilizing advanced modeling techniques. The government seeks to identify high-risk areas, allocate resources effectively, and implement targeted interventions, ultimately contributing to the reduction of malaria transmissions. From the nation's capital, Consilia Ewuzie.